finance and wealth.
Keep track of your spending. And part of the spending, of course, as we said, be able to separate wants from needs. That's secondly.
Leadership and governance.
There are people who take on the political aspect and try to water down important, significant decisions we leaders take for the good of this country.
Not forgetting parenting.
Now you're raising kids or children who are in a totally different time. You get it. Those days your mother would just give you an eye and you know this is a problem.
Hey, there are visitors.
And it's just there are visitors
and
around.
Mom gives you this eye, you know?
Yes.
Catch more of this every Monday to Friday at 9 p.m.
Welcome to the Family Hour. It's another interesting evening, and we thank God for you who is watching us right now. Adrian Austin Mukalazi is my name. Today is a Tuesday, and as usual, on the menu, we are discussing health today, and we have an interesting topic today in our edition of Family Hour. But just to take you through a few updates, this Thursday we are having the children's event at the Uganda Matters site, the Anglican site in Mugongo. Therefore, parents, before you take those children back to school, please take them to their day. It is their day. There is a lot that is going to happen on that day, and then the following day on Friday will be the youth day. Therefore, take those young adolescents to that place, and I believe their lives will be changed. But also on the 29th of June, that is next month, the Interreligious Council, together with the Global Peace Foundation and the government of Uganda, have organized the first IRCU Family Festival. This is going to be an interesting event because it is bringing together very many people. The President, His Excellency Yoweri Kaguta Museveni, together with Mama Janet, are the guests of honor. But we shall also have other presidents and other former presidents or the past presidents from all over Africa. We shall have cultural and religious leaders. So we call upon all the religious leaders, parents, youths to be part of this event as we embark on Africa's renaissance through the family. And therefore, please make sure that you be part of that day. Entrance is free. It is at Kololo Independence Grounds from 8 a.m. to late. There'll be also lunch, so don't worry about what you will eat. Lunch will be served, so it will be a very good day. Don't miss out on the speakers. I believe your life will not be the same as we embark on Africa's renaissance. Now, getting into today's topic, it is another interesting topic, and today we are looking at dental caries. So this is something very important, especially now that our children are getting back to school. It is important that we discuss such a topic. It is suicidal to take back your child to school with dental issues. So listen through. Parent, a child, they are watching us, listen through, and you can as well listen on behalf of your sister or brother, and you'll guide them or you will help them. With us is none other than Dr. Tademwa Edwin from Truvine Dental Clinic. It's a pleasure having you this evening, Doctor.
Thank you so much.
It's
a real pleasure to meet you.
Indeed. How is Truvine?
Truvine is it's so good.
Okay, that's good.
If we find that we can put a hand on someone's tooth, it's restored or it gains function.
Okay.
So happiness.
You know, there is something that we undermine, and that is dental health. A few people pay attention to dental health. You realize that most of the campaigns on these other diseases like malaria, HIV, and very many others. And a few moments we see the ministry coming up to sensitize people about dental oral health, and you're really doing a very, very tremendous job, and we have no doubt you are handling a unit which manages our bodies, because you can never smile if you have issues with your teeth.
I think that's why I can even easily smile.
Exactly.
Right.
But talking about dental caries, what are dental caries?
So, like, I wouldn't start on. You see, when we are introducing this topic, I want it, like our viewers, Family TV, I want to bring it out clearly. Because they're hearing dental caries.
Yes.
I want to bring it to layman's language,
Exactly.
what someone can easily understand.
Yes.
What we are talking about today.
Yes.
So if someone has ever had something they call tooth decay, I think there someone who is watching Family TV now can get what exactly we are talking about. You get? So you mentioned that people are having children, they let them watch, but this one applies even to you, to me. Caries can attack anyone. You get? First of all, we I don't know how many minutes we are here, but then I wanted to be time bound.
Please, we want to our main objective is not that time, but we want people to understand
Exactly.
and
Then
get a solution. At least by the end of this hour, someone will have picked out something.
Thank you so much. So, our dear viewers, when I come here to tell you about dental caries, it may sound something new, but when we break it into the real part of
Yes.
you'll feel even. Maybe you may say, I may be having a caries.
You'll go into the mirror.
So, Ms. Edrin, I would like to start by introducing myself again. Dr. Tarimo Edwin. I think the name is almost resemble.
I was once Rin. I was once Win. And then maybe the name changing events happened and I ended up becoming Rin.
All right.
I also don't know how I became Rin, but I was once Win. Yes.
So now we are going to talk about dental caries,
Yes.
but I want to first bring out where does it occur. You see, we are talking about generally the thing would be oral health, but now in our oral cavity, we find we have different structures.
Yes.
You get without excluding the teeth. Teeth, the tongue, the cheeks, the lips, everything, the gum, the throat. But here we are finding caries. I can call it like a localized. It is localized on a tooth surface. You get a tooth surface. This I'm going to talk about how it comes about.
Yes.
But now I'm telling you where does it attack. You get? So regardless of the surface of the tooth, but provided it is on a tooth surface, whether which side I may call it, our viewers, when you hear about something called the surface, I'm meaning which side of the tooth. Because I want to bring what we are discussing, the things we used to discuss them when we are studying, but now I want to bring it to someone to
reality, so that someone
can understand,
associate with what you're talking
what
about.
is taking place in the in his oral cavity. You get? So you find like a tooth is having different surfaces or different parts, if I may call it. You see, there is this part where you can come where when you bite biting teeth like this, the occlusal, I can call it occlusal surface, or where the teeth meet. There caries can do what can be there. Then there are these surface towards the tongue, surface towards the cheeks. We have our medical terms, which I wouldn't wish to use. Yes.
You don't want to go there.
I didn't want to bring it to that extent. I want to bring it the language which everyone is seeing us on Family TV can really interpret.
Exactly.
So what I'm meaning, it can occur anywhere, or any part of the tooth. You get? Then now I want to bring out how does it come about.
Yes.
because I think that's why we really want
because
to dig deep
from
into-
childhood we've grown up hearing about tooth decay. But I mean, we want to understand it in
Now
detail,
I
how
want
it
to-
comes
I
about.
want to really bring it out. So now you see when you everything that starts, that I can call it pathological, or anything that causes a disease, or that is due to a disease, it normally has, I can call it an origin, or maybe like a cause. So for this time of dental caries, you are going to find everything. In fact, some of the oral conditions, they are due to I can relate it to nutrition or the diet. This one, in case for dental caries, I'm relating it more to the diet we take.
Okay.
So now
Very interesting.
Yeah. So how you may ask yourself, I eat to live, I eat to grow, I eat to what? Now it is causing me problems. You get? So you realize that in our oral cavity, we find there is bacteria. As a matter of fact, God created us with what? With bacteria. So then when we talk about when I want to bring in the issue of the food we take, the food we take wouldn't be bad. You understand?
Yes.
But then you have taken it. It has gone into the what? It has gone onto the tooth surfaces. Ideally, here I come on with the oral hygiene. Ideally, after eating a meal, I've told you those different tooth surfaces. You are supposed to get a toothbrush, clean thoroughly the different tooth surfaces, using different techniques of brushing. Maybe if we get time, we may go through them. We see how best we can prevent this. But I want to first bring out how it occurs.
Yes.
You get? So you have taken food, but mistakenly, you didn't get time, you didn't do it, but you have not got the toothbrush to clear all that, I may call it the debris or the remains of food.
Someone would say, okay, I probably am having my lunch and I'm unable to get a brush. But what if I get water and I rinse my teeth, or I can spit out the water, or I take it in? Isn't that a substitute?
That one can't be a substitute. That one cannot be a substitute. In a way, as I've told you, these two surfaces, they are not just like flat or smooth like this table would be. You get? There are some parts which may be called maybe pits and fissures. There are those grooves. It's not all that straight. So there's a likelihood, or even interdental space, that space between two different teeth. It's more like that when you rinse with your water, it may not do what? It may not remove that food debris. So I now want to bring out, how does it come?
Yeah.
Like food has stayed. You get? And mostly now we are considering dietary carbohydrates. These are maybe you can break it into, you call it foods which contain sugars, if I may bring it in that way. You get? We eat different foodstuffs, but you realize in a day you can't fail to take foods that contain sugars at the final product. You get? Or you may call them carbohydrates. So now, as I had told, the other bacteria that are always in the oral cavity, they come and they get attached to the what? They mix with those the other food. It mixes with the other bacteria. So now, if I may break it simply, there happens a chemical reaction. You get? So
the bacteria and the food particles.
And the food containing what? Sugars,
yes.
They undergo a chemical reaction which will bring out acidity. Now when we come to the point of acidity, that's when everything will start in. Because acid burns, or say it corrodes. That's why you hear in these people of peptic ulcer disease, there is some acid that brings about that, to dig that hole. You get? So at that point, after that chemical reaction has occurred, it's when we are seeing caries starting, which you may call tooth decay. How does it happen? When that acid, now we are going to talk about the effect of that acid on the tooth surface. When you have to realize our tooth is having different parts. Now if you talk about the anatomy of the tooth, the uppermost part, which you may evidence like or see in the what? in the oral cavity. That is the upper part called the enamel or the enamel.
The one we see.
The one we see. That one is the one which, of course, that's where the acid will attack first. You get
Because it is where the food remains are.
There are some terms which we use like acid demineralizes, but now to break it, acid weakens the enamel. I think now that one is clear.
Very
dear
clear.
Viewers.
Very clear.
It weakens the what?
The enamel.
That upper part. So when it weakens, it you see, like, if I may use a live example, a mere wall, a wall like this. If you pour water onto it, I'm just rating that such example.
Yes.
There is a way it will start shaking. You get? It is the same way when this acid has attacked the what? A tooth surface, that specifically the enamel. It will be so soft, and then it becomes porous. Porous is like something can easily be penetrated. You get? Then now that carries, now that one we come to carries progression. They keep, remember there were bacteria up outside when something is created,
which
like
were useful.
Which were useful because they have their own function they play there. But now they have gone into a place which you are not supposed to be going into. You get? Now they have the enamel structure is destroyed. You get? So after being destroyed, now the caries will keep digging inside. The part just underneath the enamel, it's the dentine. Our dear viewers, like, I'm trying to break out to see how you eventually come out with a hole in a tooth. Or a tooth has decayed.
In other words, it doesn't come in a night.
No.
You sleep and then you wake up and you say, hey, it has just come. Okay.
It's gradual.
So that's the process we're talking about.
That's the process I'm trying to break down. So now it has reached the dentine.
Yeah.
In most cases, you are like not to find, it's like it to be painless when it is just attacking you. You get? On the enamel. Then when it reaches the sensitive part, the dentine, now you start, that's when someone comes and says, they may come to the clinics telling you, so the tooth is so sensitive. I take cold water, I feel sensitive. Hot water, I didn't sleep. You get that? So now it keeps on going. Then there is another most useful part, which is called the pulp. Pulp is it is hollow. It has a space inside it. It's in between the roots. You see how deep it is going now. So now once it has attacked that pulp, it means that pulp contains nerves, blood vessels. That shows that it is very crucial. Yes. So when the caries has attacked that part, someone will come telling you, I didn't sleep. So
is that when we start thinking of now the toothache?
The toothache, actually it is very severe. That's the moment people like that. In fact, it's the mistake people make, and you find that's when they seek for what? Dental checkup.
Where are you going then?
Whereby you find, I'm telling you, whereby when maybe the procedures like to restore your tooth structure, like maybe talk about root canal treatment, which is a bit expensive. You get? Because now I find it why say interesting? Why you say what? These conditions of the teeth are the conditions which are very cheap to prevent.
Like I said earlier, to you the practitioners, you realize they're cheap, but I think there is lack of awareness and publicity that now, like you're explaining this process doesn't happen in one night. It is something that takes time, but not until you've started seeing now this extreme effect, that is when you start. But no one can ever go to the dental clinic and somehow
at least
I want you to check
people who are viewing this program. At least I want them to know when should they go themselves.
Exactly. Before we get to that, you are still explaining the process. So someone has come to the clinic with this severe pain. Now, what about the swelling? What brings the swelling? Because to some of us, it's until you see the swelling. Before the swelling, you'll of course use some antibiotics and painkillers and you go about it. Until when you see a swell, that is when you'll now run to the
So now I was
clinic.
still telling you, the caries has progressed down to the what? The other part with blood vessels, with the nerves, the one that supply impulses in the what? The tooth. So now how does it going to come out? The swelling. You know, when it attacks the blood vessels, you get it attacks the blood vessels, it will cause like there is a process called the inflammation. It has a lot of steps which may not break down right now, but provided you have interfered with saturation, you get blood saturation, the blood vessels pass the anatomy, how someone like how God made our tooth. He put some alcohol underneath the root where blood vessels enter in from. So when now our blood saturation has been to the tooth has been interfered with, that's why you see the swelling you're talking about is always under this, around here, because the tooth ideally if you may call, maybe it originates from this bone, alveolar bone. So since it is the origin and it's where the blood vessels pass through, that's why you will find that even people develop over cancers, over what, just because they get some of those things, some signs you're talking about, but they are reluctant to go and treat them. You get, you see how worse it is. Then I was still bringing to you like from going back to the first stage, how when it has just entered the other enemy, the other topmost part. I want to tell you how it becomes easier and easier for us to manage than when it is already what? Worse. For you, I told you, you may not realize that small opening has happened on your what? On your tooth surface. Reason being, it is not painful. That one you can only know if you're keen enough. You look through your mirror and you see maybe there is change on my tooth structure. That's if you're lucky for a few. But then that now.
Is it what you call malalignment?
Not really.
Or that is also different?
That is now another thing.
We shall talk about that.
Then when like I was telling you, like that's the chance you can get, or you use maybe your phone. It reflects. You see what is happening in your oral cavity. You can tell. But then that one can best be done when someone takes a move. Just say, let me go to the dental clinic and I just check. That's when we can diagnose that. Because for us we have different techniques we can use even to see those ones you wouldn't have seen. You get? But now, what do we do when we are found with that small thing?
Doctor, at that point, let's take a short commercial break. When we return, we are going to pick it up from there. What do you do when you notice there is a problem? We are coming back shortly.
Thank you.
Just give you an eye and you know this is a problem.
There are visitors.
And it's just there are visitors
and
around.
Mom gives you this eye, you know?
Yes.
Catch more of this every Monday to Friday at 9 p.m.
Welcome back from the commercial break. This is Family Hour, and we are talking about dental caries. Adrian Austin Mkalazi is my name. With us in studio is Dr. Taremwa Edwin. Feel free to be part of this discussion by joining through. You can watch live on our YouTube channel, COU Family TV, but you can as well be part of the conversation on our other social media platforms. That is COU Family TV on X and COU Family TV on Facebook. Doctor, before the break, you had told us what to do now. I have come voluntarily to the clinic. I step in, and what do you do when I've come?
When we are so lucky that you have come now, because
sometimes
why I'm telling you we are so lucky, because at that point we are going to prevent the progression, the process I explained to you.
Yes,
that's why I tell you I even become more happy when I receive a patient or a client at that extent. It has just started, someone has come to me, I feel so lucky. Now what do we do? That's what I'm going to do.
Yes.
So like that one is, you may call it caries, but now the truth is there is a cavity or a hole. You can call it a hole. It has formed. So we do what they call cavity filling. We feel there are different materials we use. That's why people call it cement. You get it?
And when I was young, I used to think you get this cement that we know, and then
so the people who are making these materials that we use, they consider the exact components of a tooth. That's what they use it to make these materials. That's why when they put what they call a cement, or can call it amalgam or what, when they put it there, that's why you will feel as if it is a normal tooth surface. When you're chewing, when you're eating, there's nothing like a difference. You get it? So when someone comes, you try to apply that material so that you feel that, because we are trying to regain, it is called rehabilitative treatment. You are trying to regain the normal lost structure of a tooth. So by doing that cavity filling, using different filling materials, you do what? You are trying to regain the normal structure of a tooth that was originally lost.
Someone would ask, instead of filling this one which is already affected, why don't you remove it and mold something similar using those materials? You mold for me one that can be replaced.
You see, like, we remove a tooth. Actually, they use called dentists
yes,
which is
up to now,
which is something very absurd to find that it is still in people's mind, that people are there to extract it.
You see, do you know partly what brought that? On signposts, dentists, instead of saying omsawo wamanyi, put omkuzu wamanyi.
Maybe so it could have come like that, maybe.
Yeah.
But now what you're bringing, extracting someone's tooth, that means that worst has come, maybe I said, to the worst. You get? Because now
from flying pan to fire.
Really, how would I dare remove someone's tooth when it is still having the normal functioning? You get? I told you the tooth is just like this. You see this finger, or your hand, your what? It has that nerve supply, blood supply. It is sensitive. It can feel anything. But now, the other tooth you're talking about, that they are going to remodel and put,
yes,
it won't have that blood supply. It will just be there to help you, maybe to chew, to smile, to do what. But try as much as possible to stay with the tooth that you are born with. You get? That's why I tell you, when you come, our priority is trying to restore the one that has been there. You get? Because it has its own benefits, and the other one comes with its own demerits. You get? So that's why we consider someone whom we have already diagnosed. Now I'm coming to even when it has reached the dentine part, the second part, we can still do the same. But now it's when it has come to the pulp, the other inner part, which I was telling you, and that has damaged the other blood vessels, all those. It's when we shall have it. I think most viewers, I think we have ever heard about what we call root canal treatment, or RCT.
Yeah.
That is, this procedure when you talk about when you are maybe off government services, you find preventing is very cheap. Buy a toothbrush, clean, what, which you find it is, you feel everyone would do it cheaply. But now you come, someone will ask you, most people have been saying, dentist, you're expensive,
Yes.
expensive, which is not a topic to discuss. Because we are trying to do what? We are trying to, Mr. Edwin, we are trying to do our best, explain to people how cheap it is to maintain our tooth structures. You get? But now you find someone is just there waiting, lousy, waiting to complain that dentists
You're
are
expensive.
expensive. You understand? Hey, because now I've taken my time, I'm explaining to people. At least I'm lucky, like I feel the ones who at the end of this program, maybe people could pick something and they say, at least I would also have undergone such a problem, but having learned something, at least I prevented this. You get? Then I will come to children, because they are the ones who are most susceptible or at risk. Now children are home.
Yeah.
You get? I was saying the other root canal treatment, that one is a bit expensive, these procedures, because the deeper you go, the more expensive it becomes. Then when you find that even root canal treatment is, we cannot do it, that's when someone will tell you, extract your tooth. We can't do anything. Sometimes people come when even the crown, the part you would see in the oral cavity, it's broken, it's not, someone tells you, I swallowed it, hey, they are there. We meet them. That I started speaking
I have
when I
a
was
friend
eating.
who woke up one morning missing one tooth,
Hey.
and then he said maybe they sent some spirits and they took away his teeth.
You
his
see,
tooth.
that is myth. But it happens, that bacteria, that acid corrodes the whole, in fact, the junction of a tooth. Then you find the whole crown is lost. Now they have to remove the what? To remove the root. That's extraction, and you find that now we're going to the other orthodontic treatment. Maybe someone has, if I may break it, someone wants to replace a tooth with a permanent or a temporary, to put a crown, there are very many different procedures. That's why now people will start saying dentistry is becoming now what? Expensive. But it's you who made it expensive at first.
You had cheap options.
You had cheap options, but you skipped them. Now I'm going to children, our children at our home.
Yes.
Because at least now I'm sure they are not tuning into cartoons, what. At least if they would listen to this, at least it would help somehow. Because you see, as I told you, the food, another person, you may regulate and you say, today I've taken Ramonda in the morning, maybe in the evening let me take something else. But a child is someone who, they might call them planned kids.
Pique.
Hey, someone has access to maybe buying sweets. They take chocolates. They take what, all of.
Not even
biscuits.
having access. The parents buy them.
Parents buy, exactly. You get.
How will I go back without sweets
That's
at
why
home?
I'm saying they are the ones considered at most risk. Because you find a child snacking 10 times or even more than 10 times in a day, gets this because they feel, or even as parents, they feel they are trying to feed their child that is maybe to grow or to enjoy life or to feel like the child of a neighbor, which is a different story. Because as I have told you, I think now you can, our viewers, you can tell the danger of these sugary foods on our teeth once you have not removed them. And you find, if an adult, if I may talk as in reality, coming back to reality,
Yes.
you find even adults, the maximum number of times you can brush the teeth can be like 2. Most people, 2, 1. Now take a look. How about a child? It means it may even be 9 or 1 at most.
We have people who go 2 days. In 2 days they brush one.
You see.
And we know them.
They are there. But now, I'm trying to say, at least it would be at low risk, bearing in mind that children don't often brush their teeth, if they would be taking in food that does not cause more harm than good. You get? Because at least it may take us time to find every child in Uganda be brushing 3 times in a day. At least that one would be, we would have jumped But now if we prevent it primarily from occurring, you get, like before taking in the other dietary carbohydrate foods,
Yes.
at least if you could maybe, this starts from parents. Because a child is there to enjoy what has been prepared.
Yeah.
You understand? Or even what is laid on table, what is available. This one, it can be like a trend at home. You say, at break time, we are using maybe if there is an apple, if there is a guava, if there is what, anything that can be available, but not adopting. I may not say that I'm over undermining this food. We have to eat because someone needs glucose to live. That's why I can't stand here and I tell you, do what? Stop taking your carbohydrate food. But as I was starting, I told you, once you have taken it, have you labored to clean your mouth? The remains. You get?
That is now where the problem is.
Then they are now, when you come back to soda, soda, it is something you cannot avoid.
Yeah.
But now I'm going to bring to you, our dear viewers, how dangerous it is to take a soda and how safe it is to take a soda. You get? I want to bring out that difference.
Yes.
It is, a soda is, even if you take it when you're hungry, you feel you are energized. Which means someone really needs some energizer.
Yeah.
You get? But now, let it be a child, let it be an adult. You've taken a soda, take a moment. They give 30 minutes to 1 hour, but I would tell you, take a period of 1 hour before brushing your teeth.
Hey.
Because you have taken a soda, it has some components they put. You get? Some chemicals they put in. So that when they, if you remember the science I told you, the way these carries come about,
Yes.
I told you the acid first makes the tooth surface soft. So the same applies to this soda. It will soften the surface of the tooth as you're using the toothbrush for it to now remove the surface. You are providing like way of caries. You get? That's how they come saying tooth decay. What? You get? So take a soda. It's not bad, but give it a moment to brush. You get?
What
'Cause
about
you may
people
think,
who...
you may say you are doing it right. Musawo told me I should brush my teeth 3 times a day.
Yes.
So, or even after snacking. But nowadays, when you do it, but you're doing it wrongly.
At a function, they have served soda. And then, how about if after taking this soda, I dilute the chemicals with water immediately?
You would say dilute, but do you know the quantity of the chemical they use it? Because that is to dilute.
I'm speaking from a layman's mind.
Yeah, and I'm like, there is a likelihood that you would dilute, but the solution stays concentrated. You get it? So that's why I wouldn't give it as an option, because people would go for it.
Yeah.
People would see it as cheaper method.
So as you pick soda, you pick water as well.
Put water, then you mix. But you may find that at the end of it all, we are not getting our goal.
Oh, yeah.
Our primary goal is now preventive. Something before it occurs. Because
Yes.
there is no one who is born with caries. These caries, we get them from what? From our daily lifestyle. You get it? We take some drinks, some alcohol, or smoke something. There are some substances which are contained in those things, which you may not know the effect they may have on the what? On the tooth surface. Because we are all rotating about the surface the tooth surface that God gave us.
Is it the reason these people who use substances and alcohol have teeth turning into yellow?
That one, it brings out something called staining. Staining. Like, staining means changing from the color to another color. You get it?
Yeah.
Some people, by the way, I may want to bring out to notice, or people to know about the normal teeth color. You get it? I've seen people coming saying, Musawo, my teeth are in a somehow yellow, I want to make them white. You get it? They want
trend.
Yeah. You understand? Well, maybe they have seen maybe an artist is having very white teeth. You see,
I mean, when you watch TikTok, people are talking red lips, white teeth. Use this to have white teeth and all those things. So probably people think it is a normal
like
thing.
it's deviating from anatomy or the way God created someone,
Okay.
the way someone is supposed to be. Yes, an ideal tooth or a tooth color is supposed to be light yellowish. Get some yellowish part, not too much, because you find there are some other conditions that affect teeth. Find they are changing the color, maybe too much fluoride. You get, there are some toothpaste you use and you find maybe it is having you have overused it, or maybe you put a lot of toothpaste, it changes the tooth color. Or even the other thing you're talking about, someone drinking alcohol, someone thinking what, smoking. Of course, smoke, even if you see a chimney in the kitchen, it changes the color, of course. So there is no way you skip from what? From changing your tooth color. But now when those things have happened, actually there is something I forgot to tell you in preventive measures of these caries. I told you when bacteria, like when food debris has been left on the tooth surface, there is something that is done cheaply in dental clinics, which is called scaling and polishing. So now that one, the other, we can call it when the food substances have packed on the tooth surface. That's why someone smile. Some people, they rarely smile, they just smile.
They do this.
They do like this. Someone is smiling like this. You get? Reason being, there are some particles which
Is this what we call kabole in local language?
I'm not a Muganda, I may not know it, but it is okay. Those things they are attached to the tooth. They are different in color. Some appear in green, some appear in black. So you find someone rarely smiles because of that. We may call it break. Then it goes and it becomes too stick on the surface. It becomes characterless. But when you have got those things, it means the acid for it is eating what? The surface. But now, when you come to the hospital, we advise do scaling and polishing. What do I mean? We have our own materials we use. You get? So we come to the tooth surface, we remove all those particles, because if you try to use a brush, you find people saying, I have a fumbi, allergies, I bleed. You get? But reason being, you are trying to remove mechanically those things, but the brush is not helping you. That's causing what? The bleeding of the gums. So when you come, we do it in a professional way. You remove all those food debris, the other where the bacteria had made colonies. We remove all of it. You see, removing the bacteria and acid, you see, you are already preventing. You are trying to remove something that would cause you problems. So we remove, because when we remove, we find there are rough surfaces. So that's why you call it scaling and polishing. We have our polish. We polish all the two surfaces and it becomes smooth again. That is a preventive
measure.
Preventive measure. When you have got such things, I think you have seen people with such things in the oral cavity. Yeah.
So does it have any side effects?
The what? The scaling?
The scaling and polishing.
No, I didn't know. Because something that is preventing, I've removed something that was going to cause more harm. You get? There is no
I look at in the process of polishing with whatever machines you use or instruments, is there no chance that the gum will be affected?
No, actually that's what
like
I used something called professional way of cleaning. It's not done by any quack doctor, someone who may call himself a dentist. You get? Because they are, even the materials we use, they are designed in a way that they shouldn't cause harm than good. Because they are, if you happen to get a chance to go into some, maybe my dental clinic or anywhere else, you find there are different materials someone would put on table, like on tray, going to work on you, but designed in different shapes. This one can make a curve on your gum. This one, because they are those food debris I was telling you, they can even go under the gum. But they are those materials that were designed in a special way that they can dig into the into the gum, underneath the gum, that is subgingival. So gundi caricature or break. You remove it, take it out, polish, everything gets done. Like
what about we have people in some communities that are still using these rudimentary ways of brushing. They get
Like-
a piece of a stick and
even
then they will,
there's charcoal.
yeah, some use charcoal,
So you find like
some use hash. Ash,
actually
sorry.
it's one way of losing your tooth structure. That one it's generally called abrasion. Those abrasive instruments you can use. That's where, but if you find someone using those sticks, some charcoal. So the moment you keep rubbing your tooth like this, rub it, you end up causing what? Losing, like it's like friction. In simple terms, that is friction. You rub something, it goes. That's why they even tell you, like if you have maybe gone for a dental checkup, EMSA would advise you don't overuse your toothbrush. Reason being, the toothbrush, when you bite like this, there's the way they carve those bristles. You get it to the extent that it will reach a time when those bristles are rough. That's why they tell you at least a month. Use it for a month, discard it, because it is just cheap. 1,000 you can get a toothbrush. This is nice.
Yeah.
2,000. How much they are even these metallic toothbrushes we just put, it cleans you, but that wouldn't be a cheapest method someone can use. You get maybe someone who has money can use it, but then it requires techniques, it requires training, what, which may even not perfect, and you end up damaging your gum. But it is a toothbrush someone can accommodate, can manage. But this, even if it has 10 children, one, changing it every month than extracting a tooth every month.
Doctor, in about 2 minutes, what are some of the take-home points you want to leave with our viewers?
The take-home points idea should be let's rely much on preventive measures, because what I can assure you, treating these teeth, as they have told you, it will become expensive to you. You get?
Yeah.
And as I have broken down some of the preventive measures that you do that you can undergo, so that you may not face these challenges, because there are very many conditions that may arise from poor oral hygiene, living around caries. You get? There are very many others. Maybe if we may get time, we do what? We discuss about them. But then the key points, prevent, which is very easy. Let's saturate the news. Tell a friend to tell a friend about possible measures you can take to prevent these oral conditions. Yes, Mr. Edry.
As we wind up, maybe in the next 30 seconds, if you would want to send out greetings to the people who have been watching you.
I wouldn't forget to, because Family TV, I think maybe why you called it family. For us at our home, we made it our TV.
Wow.
My mom, we prefer call her Nyabo.
Hey.
What I know, she's there.
Okay.
Nyabo, people call her Kenyongole, but me, I deserve to call her Nyabo. My sister in Muvende, the husband Francis, my sister, she's called Nimsima Hilda. Edith is there in Bukoto watching live. My friends, I wouldn't say all, but yeah.
We are grateful. Thank you so much. One, for sparing your time to come and educate our viewers out there, because we really need oral health sensitization and oral health awareness. So we really appreciate you. Thank you so much for dedicating this time. And to you, our viewer, I believe this message has come at the right time. Please do what other people tell you to do. I mean, the professionals tell you to do. Don't stick to. We have people down here who sell. When I talk about down here, I'm talking about somewhere next to church house. People sell a pack of medicine treating all diseases, including the teeth. But I mean, please get all your oral information from professionals.